Dear students, in the last lecture, we have started our discussion of body temperature regulation. Now, in today's topic, we will finish this regulation of body temperature with few left part as well as applied part. So, let us start. Now, there is a term set point for temperature control. As we have discussed in the last lecture, we are homeothermic animals. So we have to keep our body temperature constant at a particular point, and this particular point is called set point. In our case, in human beings, the set point is 37.1 degree Celsius. So in any case, our temperature regulating mechanisms will try to reach towards 37.1 degree Celsius. Now suppose if due to any reason, if your body temperature starts rising above 37.1, then your heat losing mechanisms will start. And opposite, if your body temperature fluctuates below 37.1, then your heat gaining mechanisms will be active, and ultimate goal of both is reach towards 37.1 degree Celsius. So all the temperature control mechanisms we have discussed in the last lecture continually attempt to bring your body temperature back to 37.1 degree Celsius. So this is set point. Now we have already discussed various temperature regulating mechanisms in our first lecture, but still few are left. So let us finish. First is behavioral control, and second one is local skin reflexes. Now this behavioral control is a very important temperature regulating mechanism in our case, in human beings. See, you all know human is very intelligent animal. So by this behavioral control, we can effectively regulate our body temperature. Let us give one example to you. Suppose if you are standing in hot weather in summer months. Now you feel hot. So what will you do first? You will try to find a shade. You will conceal your body in a shade. Then if you are at the home, you will start a fan, you will start air conditioner, you will start air cooler. Then in winter months, you will use blankets, you will use woolens. So this is called behavioral control. So this behavioral control will effectively help us to regulate our body temperature. And the second is local skin reflexes. Now the name itself indicates it is local, it is not general. So suppose if you put your hand in a cold water, then what will happen? Now your blood vessels will do vasoconstriction in that particular hand only, not in your whole body. So this is a local response. Similarly, if you will put your another hand in hot water, now in that particular hand, your blood vessels will go under vasodilatation. So our skin will produce local response. So our exposed part of the body, especially during the winter months, they will do vasoconstriction, and it is very important to regulate our body temperature. So with this, we have finished all the temperature regulating mechanisms. Now let us move towards applied aspects, various abnormalities related to body temperature regulation. Now let us start with a very important topic, fever. Fever is also known as pyrexia. All of we have experienced feeling of fever in our life. So we all know it is elevation of body temperature. Now important thing is elevation of body temperature in conjunction with increase in the hypothalamic set point. So this line is very important, hypothalamic set point. Suppose if your body temperature is elevated without any change in set point, then truly it is not a fever. You may call it hyperthermia. So fever is a type of hyperthermia. Now what are the causes of fever? Most common cause is infection. May be bacterial, it may be viral, it may be protozoal. At present, we are passing through COVID-19, that is a viral infection. So we can find fever in COVID-19 patients. Second is tissue destruction like trauma, myocardial infarction in heart, then in cancers, neoplasms, and last is pyrexia, in which you will not find any particular reason. It is called pyrexia of unknown origin. You will find this topic in detail in your final MBBS. So these are the various causes of fever. Now let us discuss pathogenesis of fever. How fever occurs in our body. What is the underlying cause or mechanism? So if we take infection, because it is the most common cause of fever, so whenever you develop any infection due to bacteria or virus or any organism in your body, your liver and other organs which carry macrophage, they will secrete few substances. I think you all know macrophage structure, function, because it was discussed in blood lectures. Now this macrophage will release the substances, and these substances are called pyrogens because they develop pyrexia. Pyrexia means fever. So they have given the name pyrogen, like interleukin 1, interleukin 6, or tumor necrosis factor, etc. So you may have discussed these pyrogens in blood lectures in the heading of cytokines. Mostly they are liberated by WBCs, various type of white blood cells. Now what these pyrogens will do, they will release prostaglandins. They will increase the production of prostaglandins, and these prostaglandins will act on hypothalamus and they will modify your set point. Now your set point of 37.1 is disturbed. So what will happen? You will develop increase in the heat production and decrease in the heat loss. So your body temperature will rise, and we are calling it fever. Okay, so this is the mechanism of fever. The main cause is increase in the prostaglandin production. So in market, commonly used drugs for fever, I think you may know the name of paracetamol. So how paracetamol will help to reduce the fever? So paracetamol will act at the level of prostaglandin production. It will inhibit prostaglandin production, and therefore it will prevent the change in hypothalamic set point. So our body temperature normalizes. So most of the drugs, antipyretic drugs, will act by inhibiting increase in the prostaglandin production. So in these pyrogens, most important is interleukin 1. Now this interleukin 1 will reset the set point of your hypothalamus temperature regulation. Now it will change the set point to a higher level. The normal level is 37.1. Now they will change it. It is more than 37.1. So what will happen? Now your brain will think that your body temperature is lower than the normal, because now set point is changed. So body will try to elevate the body temperature. Okay, so even though you have more body temperature, you will feel cool, you will have rigor, you will have chills, you will use the blankets even though you have more body temperature. So why? Because now your brain is confused. Now your brain will think that I have to increase my body temperature because my body temperature is lower, but in fact it is not lower. So to raise the body temperature, as we have discussed in the last lecture, various mechanisms will become active, like vasoconstriction, piloerection, epinephrine secretion, and shivering in severe cases. So we will feel chills, we will feel extremely cold, even though our body temperature is already above the normal. Okay. Now in applied aspect, another topic is heat stroke. It is different than fever. Here our body temperature rises in the range of 105 to 108 degree Fahrenheit. Okay. Now mostly this heat stroke is seen among the workers who work under hot summer months. Okay. So what are the symptoms? Symptoms like dizziness, then abdominal distress, sometimes it may be delirium, loss of consciousness, and if not treated, even death may occur in the heat stroke. So it is a severe hyperthermia. So this hyperthermia is damaging to our body tissues, especially the brain. So it must be treated very promptly. First treatment will be spraying of the water and cooling by the fan, so that drastically your body temperature will come down to lower values. Okay, otherwise it will be fatal to life. So if any worker who is working in the hot summer months for many hours suddenly fall unconscious and brought to hospital, and if his body temperature is very high, then first step should be spraying the water and cooling his body, and then start the treatment. It may be life saving. So this is about heat stroke. Last topic of applied aspect is frostbite. It is actually cold injury. So when our body is exposed to extremely low temperature, then frostbite may develop. Surface area will freeze, and this freezing is called frostbite. So if you happen to go a place having minus Celsius, minus temperature, then if you have not covered your all the body parts properly, there are chances of getting frostbite. So especially the non-exposed parts like our digits, ear lobes, they are involved in frostbite. Now what will happen in the frostbite? There is extreme vasoconstriction to the affected area. So blood supply will become sluggish and almost stops. So our peripheral tissues, peripheral cells will not get adequate oxygen and nutrients, and now these cells will die. There will be necrosis of the cells or gangrene of the cells, and it is called frostbites. It is due to permanent circulatory impairment. So digits will look black, becomes dark because of these dead cells. It is a very dangerous condition. Once you will develop gangrene, then it is not possible to recover from that situation, and then finally amputation of the digits have to be done. So properly cover your peripheral exposed parts if you are traveling to very cold regions. Okay, so this is all about body temperature regulation and applied aspects. Thank you.